Yeah. And the lower extremity? You want me to do the lower extremity as well?
Yes.
Okay. How do you do?
Inspect the gait, right?
Inspect the gait. You can ask the patient to walk for a few feet, okay, and check for the gait. See if there is any problem. What is the hip problems that you expect for the gait? What are the problems with the hip? You can have dislocation of the hip. You can have femur neck fracture. You can have Trendelenburg sign positive. Okay, you're testing for hip. Okay, Trendelenburg sign. What is Trendelenburg sign positive? Means the patient is trying to stand on the right hip. The hip would drop to the opposite side if there is a damage to the superior gluteal nerve on the right side. Okay, where there's loss of a function of gluteus medius and gluteus minimus. Alright, so then inspection again. What are the bony prominences that you have to appreciate in the patient around the hip? Is this anterior superior iliac spine, posterior superior iliac spine, and the ischial tuberosity. Okay, what is the bursa? Any bony prominences, usually they have bursa to protect the friction between the bone and the outer hard surfaces. Okay, if there is any inflammation of the ischial tuberosity, people who are sitting for a long time, like you guys sit for 8 hours, you might have problems with the ischial bursa.
Do this if it's a female? Are they going to be comfortable when we do that? Palpate the ischial tuberosity?
You ask them. Every exam you ask them, I'm going to do this. Are you okay if I do this? You cannot just go ahead and do everything that you want, right? You have to get the permission of the patient, whatever you want to do first. If patient says no, you're not going to do it.
All right.
Yes? Okay.
I'll hope your patient says no.
All right. So then you do the movements. Could you please lie down? Come up a little bit. Do you mind taking off your shoes?
Sorry.
Right. Okay, good. Alright. What is that you're recording? Me or him?
Both?
Both? Okay, good. Alright. So what are the movements of the hip? Flexion, extension, abduction, adduction, internal and external rotation, right? So how do you test for flexion? Okay, do the flexion. Before you do the flexion, what you have to do is put your hand on the lumbar lordosis, where the lumbar lordosis is. Ask the patient to do the flexion. Okay, what else you have to notice when you're doing the flexion? Also notice the opposite hip. If the opposite hip is extended, that's normal. If it goes into flexion, what do you call that? Flexion, deformity of the hip of the opposite side. Okay, so normally there should be loss of lumbar lordosis.
Like you're doing the other exam.
Okay, you're doing the lumbar lordosis. Sorry, what is that?
I think you're doing a different exam. That's pretty motor system illumination. We're on musculoskeletal. You're doing this. We're on this.
The musculoskeletal exam?
Yeah. The one you were just doing was on this.
Pause the video.
I don't know how to pause it.
I think it's
Flexibility needs patients. Is this one doesn't say anything about it?
Sorry.
Inspect gait, deformity, muscle wasting, Trendelenburg sign, palpate tenderness, intersuperior iliac spine. Oh, there are no hip movements? What do you do for hip?
Nothing, because it's on.
Oh. I need to look at the checklist. Okay. What are the movements of the hip? How do you examine the hip without doing the movements? Right? So this is flexion. Extension is ask the patient to come towards the end of the table, okay, and try to extend his hip. Okay. What are abduction, adduction? This is adduction. This is abduction. What is that you have to hold when you are trying to do this abduction, adduction? Hold the opposite hip, okay, so that you know that the hip is not moving. It is just the hip joint on the same side that's moving. Okay, abduction and adduction. How do you do internal rotation, external rotation? Internal rotation is just moving the hip inside, okay, and external rotation is moving the hip away. Okay, those are, I'm not checking the strength, okay, that's motor. Okay, this is just the movements for the hip. Next is the knee. Okay, what are the things that you would
Palpate the patella.
palpate the patella? Inspection? There's no inspection?
I'm just reading what it says here.
Inspect, okay?
Right here.
Inspect any signs of inflammation.
It's part of the hip.
I think they messed it up. Messed it up. Okay, I'll look into. Okay, look for any signs of inflammation. What are the abnormalities that you can expect in the knee or inspection? What are the common types of problems? That bursitis, if there is bursitis, inflammation, redness, swelling, you can see on the patella. Okay, injury of the patella. Okay, all right. So patellar injury, and the damage to the knee joint. What is the most common damage? Injury to the knee joint.
Tear ACL.
Damage to your medial meniscus, anterior cruciate ligament, and medial collateral ligament. Okay, medial collateral ligament. Okay, so after inspection, okay, to palpate the entire the bone, the tendon, okay, around it, see if there is any tenderness, okay, any signs of inflammation. If there is tenderness, that would be inflammation, okay. Then also examine the palpate the joint space on either side, okay, palpate the joint space on either side, okay. You can do it on both sides. All right. So what are the other tests that you want to do for the knee?
Check for
For
effusions.
palpating patella, test for effusions. Okay, let's do the anterior cruciate ligament to 90 degrees. Okay, hold on either side of the tibia and try to pull it forward with more laxity. That means damage to anterior cruciate ligament. Push it backwards. See if there is any movement going backwards. Okay, anterior cruciate ligament prevents the anterior movement of the tibia. Posterior cruciate ligament prevents posterior movement of the tibia. Okay. So what is the other test that you do for anterior cruciate ligament? Latchment test. Okay, latchment test at the 15 degrees angle. Okay, hold the leg. All right, just relax. Just relax at the 15 degrees flexion. Try to push this one and try to pull this one up. Okay, that's the latchment test.